If you've had surgery on your spine and it looks like this with these screws, or have had your hip replaced, can you and should you be going to a chiropractor? I would argue yes to both, and actually I would say it's more important. Let me show you objectively why. So let's start with patient demographics. So we got a 60-year-old female. She came in here with her granddaughter, saw me work on her granddaughter, and didn't know if I could work on her given all of these surgeries going on. I said yes, let's start with some pictures and let's see if we can work on you. So we took a lateral lumbar and an A to P view where you can see that she has this fusion in here. So L3, L4, L5 have been fused. She presented before this with severe low back pain that was going down into her leg. She did conservative care, PT. They fused this, and this did indeed knock out her symptoms, so she felt better. But when you get these segments fused, what happens, and this is literally all the time, I hate that word literally, but literally every single time you have this fusion, the segments above it and below it start going to hell. And exactly that is happening right here. So look at the L2 and the L1 right in there. You see the front portion, we have this little spike going on. That is that segment degenerating. What's happened is you've had all of this fusion in here, that all of that range of motion is going up to these joint complexes in here. Let me show you what a normal one looks like. So this is how we normally would have a spine. So this is a lateral lumbar. You see how the spaces are all nice and wide, nothing funky coming off the front, everything looks the same. When we go into degeneration, we start getting these little spikes here. So that's basically just what arthritis looks like. So I got a whole bunch of other examples here. I just went into Google and typed in degenerative disc disease or DDD, and you can see you start getting those spikes coming off the front here. With those lumbar segments, when you get them fused, there's 6 joints associated with every segment. So you got 1, 2, 3, 4, 5, and 6 with the disc joints in there. When they fuse them, it's not just one joint that's getting fused, it's 6 joints per segment. So you got 6, 6, and 6 joints. So 18 joints that are getting fused, that all of that range of motion is being put on this one complex in here. So it starts degenerating faster. So boom, right in there, you can see that little spike. This happens with literally every single fusion. Fortunately with her, it was the lower segment that got fused, so the bottom one, the tailbone, doesn't start degenerating as fast, but that top one is starting to get it really bad. So what we do is we're not doing anything with this. I can't, as a chiropractor, move anything in there, but I can keep that one from getting bad. So the first treatment we start with is just flexion distraction, where I contact at the back portion of each unfused segment, lower the legs down, and apply pressure upwards to decompress that segment. This will get the flexion and extension range of motions reestablished within the joint complex. Secondly, we lower the legs down and apply a lateral bend, which gets the facets decompressed with lateral motion and rotation. Now, in addition to working on this joint complex and decompressing it and getting those biomechanics moving properly, I also give my patients stabilization exercises. So that includes a lot of core work and a lot of glute work. Those exercises